Usually at this point, Gina's been saying some very choice words, so
I'm trying very hard.
she's doing very, very well. How's it going, everybody? It's Dr. Nick here at Chiropractic. We're here today with Gina.
Hi.
Gina is a very unique case, so kind of want to introduce you to you guys and just kind of talk about what we've been doing with her. Gina's been coming to us for 3 weeks?
No, longer than that.
Longer than that? Maybe a month?
Yeah.
She initially came in with primary low back pain.
Yep.
And then some older stuff, some left shoulder discomfort. But the big issue, though, for you is
My lower back.
your low back. Okay. And this all started when?
I would say five years ago or something, but
Okay.
maybe it could be like before that or something. You know, it's
Okay.
been a long road.
She has a track history of injuring herself, very extensive. The most prominent being.
I don't know if I can name just one.
Okay.
It was kind of a snowball effect, I
Yeah.
think, that I was receiving cortisone shots for, and you could say the day after a soccer game, I was like, uh-oh, and it went downhill very quickly, and it just progressed over time from cortisone shots and seeking out chiropractic help to then surgery.
So, very active, young as well. So it's unique to see how much work she's had done on her back prior to coming to see us here.
Yep.
So the shots worked until they didn't. Is that reasonable to say?
Yeah.
And then you sought an ortho consult. Two orthos.
Yep.
You had 1 or 2 surgeries.
One surgery, when they went in there, I had a microdiscectomy, but he
Okay.
said it's really not a micro. He's like, you lost your disc between your S5 and L1, and then he would go in there and determine if I needed a full cage. So at the moment, I just have that one. Just the disc is gone, and all the PT and then chiropractic work to try to keep me moving and happy
for sure,
and less pain.
So when she says her disc is gone, they didn't cut all of it out with the surgery. They cleaned up, some debris where it was hanging out where it shouldn't be. So they cleaned it up. They're referring to probably degenerative disc disease, where the disc slowly starts to wear out and get flat, and you lose height. So you're not really losing too much, but you're just losing that cushion aspect of the disc.
Ruptured into my spinal cord.
Exactly.
And so I had nerve damage.
So she had probably a sequestration, a herniation.
Yes,
a sequestration is when fragments of that disc are free floating.
Yeah.
Within.
I saw it in my MRI. It was like it was.
Yeah.
I remember seeing the look on their faces, thinking like, "Oh, I'm just a wimp from the pain," and then they looked at it and they looked at me.
No,
I was like, "Can I see it?" And I was like,
yeah.
And they were like, "Yeah," and they booked me for surgery.
So in situations like that, surgery is a very good thing because it's clearing that tissue out, because it was interfering with nerves, and we don't like that. We don't want to see that stuff. So she did the right course of action. She got it cleaned up, but now she still, of course, has some discomfort associated with degenerative disc, loss of disc height, extra wear and tear on the joints and stuff like that. She plays soccer.
Yep.
You ride horses?
I ride horses.
Yep.
I wakeboard, snowboard, wake surf. And
Yeah.
I do lots of sports. I raced cars for a while, so granted, no bad crashes, but you have to have a very strong core when you're quartered.
Yeah.
Like, you're getting jostled around a lot. I don't know. If it's a fun sport and there's adrenaline involved, I've probably done it.
She's a bit of a junkie.
Yeah.
So what we've been doing with her is manual work, of course. We've been doing some dry needling. She responds well with traction, and we're implementing some more strengthening stuff, but also McKenzie's, right? We've shown you how to do some McKenzie's. Cool. Let's get you adjusted first, then we'll go from there. Let me get you on your stomach here first.
Bring this with me, I guess.
You can if you want.
Do I need to? Want me to hold
If you don't want to, I'll take it.
I don't know what to do with it. It's your video.
I'll double it up. Will that mess with the audio if I double it up, Carly?
And I can hold it.
Cool. Yeah, go in your stomach. Otherwise, it'd be clipped to your chest, and it would just be listening
that's why I was
to
like,
you
I can, like,
breathe the whole time. I feel special anyways with 2 microphones, so.
You are special.
Thanks, Gina. My mom tells me that every morning. So outside of the low back, what were the other problem areas?
Like up in between my shoulder blades, where you've been getting it, and then you did the other one on that like table in the hallway that was awesome.
Yeah, the hands over the head.
My, you always get my neck, like I think I clench my jaw from stress, and when you adjust my neck, it always feels like really, really good. And then working on my shoulder from that separation a couple months ago.
She has maybe a grade 1 AC joint separation from doing what?
Getting tossed off the track thoroughbred.
Yep, riding a horse. All right, take a breath in and let it out. Good. A little bit higher up. Breath in and let it out. Good. Let me get you right side down first. Cool. Let the knee bend. And then I'm gonna tuck you like that. Oh, good. Other side. For as much as she's damaged herself, she moves very well, so.
I find people to take good care of me.
You just have to find the portion of you that wants to take care of yourself as well. Go on your back.
Okay. That was a good one. Can we not record the knee thing?
The knee?
Can we not? I don't think that's...
You don't want to squirm and be uncomfortable?
I can try.
No, we don't have to.
I mean...
Good.
I don't know if that's good for people to see. I don't know if that makes for good interviewing.
No, we don't have to record you suffering for other people's enjoyment.
I mean, it works.
Alright. A little pull. Same thing right here. Good. Alright, so next we're going to jump out to dry needles. You've already had decompression therapy, right? The traction?
Yes.
Cool. She did that first.
Busy day.
Yeah. So we're going to jump out to needles. I'll see you guys there. So this is Gina's favorite part by a long shot.
It's useful. It helps. I just don't.
She doesn't like it.
Yeah, she's got to unlock in there.
So for the month that we have been working with Gina, most of it right now has been kind of the pain management side of things. So I want to get her feeling like a normal human again. And then when she gets to that point, we're definitely going to start tapering off the passive stuff. So the needles, the traction, stuff like that. We'll start to incorporate it only when she needs it. But at that point,
Read the first sentence.
she's going to take in a more aggressive, active role with her time here in the office. Of course, if any of these are too painful, all right, you let me know.
She had that one.
Say again?
Some of them don't hurt at all.
Yeah.
That nerve.
The ones you feel the most are finding their way into a very fun trigger point. So through here, I like to get through the lumbar erectors, get it down deep enough to hit the multifidi, And then from here, we're getting portions of her QL, or quadratus lumborum, which is a fun, tiny muscle that sits between the top of your iliac crest and the lower portion of your 12th rib. That's responsible for some side bending, maybe a little rotation of the trunk. But when you have as much going on as Gina does, these muscles get very tense and very tight because movement's a little provocative to this region. So they're on lockdown, trying to prevent a little bit of that movement so she doesn't make anything more unhappy than what it is. Yeah, fun one. I'm going to trade you spots here where we can work up the left shoulder.
The last man standing. Almost.
Usually at this point, Gina's been saying some very choice words, so
I'm trying very hard.
she's doing very, very well. Not being a sailor.
To enjoy this. I'm trying very hard.
I don't enjoy hurting people as much as you think I do.
I don't think you really enjoy it, but also if I say the wrong thing, I end up laughing.
And that is not comfortable.
Yeah, laughing with needles in is not a cool experience. I've had to sneeze once with needles in my neck, and it was, you know, borderline traumatizing. So right now we're getting through the upper portion of her trap. Out through here, I'm getting through her AC joint capsule. And at this point, she gets to hang out and cook like a rotisserie chicken for 10 minutes. You cool with all those?
Yeah.
Awesome.
On the right side?
No, not today.
Cool.
Not today.
That wasn't as bad.
Good.
Good, how are you?
You are hanging out for 10. Of course, if you need anything, just use your outdoor voice and holler. We'll be in to help.
I'm good.
Cool.
And then you're going to hit me with the stem, yeah?
Yeah.
Yes.
Awesome.
My next favorite part.
Good. We'll see you in a bit.
Thank you, Dr. Nick.
You're very welcome.
Hey everybody, this is Dr. Warren here at Kelstein Chiropractic. I'm with our preceptor, Kendra, who just joined us back from chiropractic school, Logan University, where I went to school. Kendra worked here for a few years as a chiropractic assistant, and she's back. She's going to be doing 8 months of work with us, and hand in hand, going to be seeing patients, going to be working with people. She's already been in clinic for over the past year, and Kendra's been awesome because she's stepped into a lot of different roles and studied under a lot of different providers. She's already dry needle certified coming back here. She'll be doing that 8 months from now. Super excited for her to have her on the team. And I'm also excited personally because Kendra's going to be taking care of me today. So I'm going to show you a video today of what it's like to get treatment when you have an aggravation to a disc. I've got some discogenic pain happening. My work is very physical, but I actually aggravated it lifting in a way that I don't normally lift. I was doing a leg press. I played lacrosse in college, and I've had some injuries to my lower back playing sports. And I use chiropractic care, I use dry needling, I use shockwave, and I use fitness to help my back stay healthy and in a good shape. But I definitely just overstressed it. I went a little too hard in the gym. My brother-in-law was a lot stronger than me. I was trying to be tough and keep up with him. And that's what happens when you try to do that. So I was like, hey, Kendra, before I go, I've got a little problem that I want you to help me out with. So she is just in the process of examining me. Kendra, first off, enough about me. Welcome back.
Thanks.
I'm so excited to have you here.
I know, excited to be here.
I get to work hand in hand with her coming back, and she's just a hard worker, and it's so fun to be able to bounce things back and forth with her from an educational standpoint, as well as just to have collaboration in this practice. It's just an environment of learning, an environment of growth. We have an amazing team right now. So if you're in the Baltimore area, it is not just Kendra and I. We have 4 other chiropractors here. We have PT techs. We have massage therapists. We have an amazing team of people that support all of those individuals that are awesome, that help people out with different forms of back pain, neck pain, different injuries that we see in the musculoskeletal sense in a conservative manner. So we don't use drugs or medicine, but we're growing in that sense. So there's more work to be done in the summer. A little sneak peek, we are integrating our practice, and we're going to have a functional nurse practitioner that supports our office with regenerative medicine very soon, in less than a month, a little bit over a month.
Yep.
So, back to me. Back to Kendra. Welcome back.
Thanks.
All right, so let's go ahead and I'm going to follow your lead. Go ahead and
Sure.
take me through a lower back exam. And then she might look at my left heel a little bit. I've got some old lacrosse injuries in the heel pad there that I'm looking forward to getting worked on too. So
Nice. All right. First, I'm going to have you bend over and try to touch your toes. And are you having pain with that?
Yeah, that kind of pulls on me a lot. I'm kind of like tender over, but that goes into my right hip a little bit and my lower back. I feel it
Okay.
right in my SI joint area.
Sure. Okay. I'm going to have you extend as far back as you can go. Any pain there?
No, it feels really good when I extend. Walking, kind of like moving around, extension helps.
Okay. I'm going to have you extend back again.
Uh-huh.
And I'm going to dip this shoulder and just apply some pressure.
Yeah, I feel it like it's not happy in there.
Okay.
That causes a little bit of that kind of achiness, referred pain into the glute. Mostly in my spine though.
Okay. We're going to do the same thing, but we're going to go the other way.
So it feels good in that space. It doesn't feel like I'm getting jammed up at all. It feels like you're opening me up, taking pressure off that
Okay.
side. My left side feels a lot better than my right.
Okay.
That's a Kemp's test.
And I'm going to have you give yourself a big hug, and then I'll have you rotate to the right. There you go. Go ahead and go to the other side.
Okay.
Any pain with either side doing that?
No, it feels okay.
Okay.
Yeah.
Hands by your side, and I'll have you lean one
Okay.
way. Good. Go ahead and go to the other side.
Nice.
How you feeling both ways?
A little achy, but it doesn't really set me off too much. Overall, it's fine.
Okay.
Yeah.
All right. I'm going to bring the table up.
So, it's been a while for people that watch our channel. If not, subscribe, check it out. We put a lot of good content out, and we have a really fun team here, and we get to share our journeys just in life, but in chiropractic, physical medicine, and we, if you have questions about some of the stuff you're seeing or your own problems, throw them below, and we'll do our best to kind of give you some good feedback. Yeah, Angie was working on me. I did my first triathlon not too long ago. Went actually really well, and so I was gonna do like a follow-up video. I just never got around to it. So sorry if you're kind of following that story, but it went well, and I've got more coming up this summer. Just kind of doing my own personal ones. One more through this company called Xterra, which is a pretty cool spot. So what are you doing now, Kendra?
I'm palpating to see if I can find a point of pain on you.
Yeah, you just passed it right in there, a little bit, like a half a centimeter north, north, there. And if you go in the spinous process a little bit more, there, yep, that's tender. And then if you go, you can palpate like right and left at those segments that are like irritated, and like don't be afraid to push down, and then go medial and get it. Yeah, so take your right hand and go anterior and go medial, and then slightly cephalic, and then you'll just feel a little bit of pressure. And then compare, like that to me is like really sensitive. So there's a nerve, the dorsal branch that comes out and innervates the facet, as well as the ligaments and tissues posterior to that segment. So you're like, how do you know that a person has a problem? Because that nerve sometimes sends a little signal and makes things a little tighter or hypertonic there, but they'll be tender too, and you can kind of start to pick that up over time.
Yeah. You said you have pain kind of going down as well, correct?
I do.
Check out his hips a little bit.
All right, so field hockey, college,
Yep.
athlete. You started working here.
Yep.
Dr. Jeff's favorite CA ever. Don't tell the other CAs.
I won't.
Hard worker. Cool, so external, internal rotation, you're palpating, you're feeling maybe some tender spots. Oh, yeah, my right hip is like on fuego.
Yeah.
So,
I do want to check out that right heel. You said it is your right heel?
left.
Left. Okay.
Yeah, you know what, let's do this. Let's go through myotomes and slump test. We're gonna do a little nerve testing, okay?
Sure.
And then, because this is a little bit more acute and we have a good idea what's going on, and you're gonna see me tomorrow, you can retest this. We don't do reflexes, we don't do sensory. I don't think that we need to dive into that too, but just kind of go through your run. Whenever you have neuro, you're gonna do myotome, reflexes,
Yep.
sensory, and then you're definitely gonna do neurodynamic testing, right? You're gonna see if there's any tension through slacking or stressing the nerve or
Yep.
helping them. And then we'll go through, normally we do McKenzie protocol for this type of a problem. We start there and then we work our way into the pain side of things as well. We want to start with McKenzie's because it teaches them and shows patients how they can really help their own back,
Right.
as well as it's very therapeutic, and it'll make you adjust them way easier. It'll be easier to adjust their back,
Yep.
right? So that would be the protocol normally, yeah.
Okay.
So do your myotome testing from here.
Okay. I'm going to bring your leg up. I'm going to have you push into my hand as hard as you can.
You're so strong, Kendra.
And I'll have you push again.
Good.
Good. I'm gonna have you kick up like you're kicking a soccer ball. Good. Pull down.
Nice.
Good.
So
And
good means that I have full strength and resisting. You keep doing your thing.
yeah. Push on me like a gas
and we would
pedal.
rate that a 5. If there's weakness, we'd rate it a 4. If they can contract but not hold against pressure, they would be a 3. And then 2 or 1 are a little bit more like advanced, and we don't see a lot of those issues in here. If we see that, that's not a good thing. Okay, that's good. That just hurts.
Go ahead and push.
Yeah, good.
Good.
Dang, Zach, you
Kick
beat
up.
me up, dude.
Good.
So he was doing this like ab workout at the very end. So we do 5 exercises, and we did 2 days of it. Right? You keep doing your thing.
Go ahead
I'm
and pull
following your
down.
lead. Yep.
Good.
And the last one was you took the battle rope and you hooked it on the back of the squat rack, and then you pulled your whole body up under your shoulders.
Yeah.
And in a flat line, you had to lower your whole body down and up. So it wasn't just your legs like doing like one of those. It was like from your shoulders
Yeah.
down. Maybe that's what did it. It was so
Might have
hard.
done it, yeah.
I was like, oh yeah, that looks easy. I can do that. It was like flop, flop. All right, what else you got for me? Strength feels good?
Yeah, strength feels awesome.
Heck yeah, I love that for myself.
We'll do slumps test now.
What's slumps test?
Okay.
Slumps test is a way of creating increased intrathecal pressure. God, am I saying that right? I want to see if there's anything encroaching in that disc space or in that foraminal space where the nerves are exiting. If it is, it will show up on this, especially when someone's aggravated or irritated in that area. It's a nice sensitive test for this. Okay.
So I'm gonna have you bring your leg up. Good. And I'm gonna have you kind of slump down, almost like you're taking a bowel movement is how we call it. Take on some bad posture.
So I can't go very far, and I'm gonna lean from the hips first. My head is gonna stay on horizon, and then from this position, my chin is gonna come down. And this motion here, the only thing that's moving is my cervical spine. But it's tugging on the nerves all the way down.
Yep.
So the reason it's really important to differentiate this and then going straight down is because you might run into someone with just like tight hamstrings.
Sure.
But you're not increasing anything in the hamstrings when you move your neck. The only thing you're doing is tightening the nerves.
Yeah.
So if it increases the symptoms that they're feeling. Hey, we're rolling, we're back. I don't know where we left off there. We just had a little bit of a question about a patient. All right, that actually really bothers me. And that makes sense, kind of what I'm feeling, what's flared up on me, and that's why I'm thinking right now, before I even came in here, that I have an idea that it might be a little disc irritation.
Yep.
All good. We see it all day long. I'm excited that we have a team here to help me out. Kendra.
Yeah.
Cool. All right. So, what to do next? Okay, so we did myotomes, we did our flossing. She's going to adjust my spine. It's really good to get your back adjusted when you have discogenic pain. It works. It helps with alleviate a lot of the pain, range of motion improves, and then I can do my things that I'm going to do out there a lot better, which are the McKenzie press-ups and extension work. We can go through that, but would you mind adjusting me first? Mm-hmm. I'm just such a taker of habit. I'm going to do that for you. Cool. Taking this off. Alright, so left lateral flexion is a little cleaner, right is a little rough, mid-back, CL junction. You adjust left side first, right side second. And then if you were to really work me over, you would do nerve flossing with psoas and piriformis. Traction on my hips and my low back. Right, and then you would do your thing.
All right, deep breath in, let it all the way out.
Oh, nice.
Deep breath in and out.
Nice.
One thing Dr. Angie does that I found also observing her while I've been here,
Yeah.
I really like that Dr. Angie grabs onto the ASIS and she does this like a little roll move
Yeah.
up the spine, and it really loosens up patients super well, I've noticed.
Oh no, that's a nice technique.
I know, I like that.
Do it. That's why we got like 5 different practitioners. Pick up different skill sets from different people. We all got our little habits and techniques and skills relative to that, and like hopefully we show you as much of that stuff that we know, and you take it and you help people.
Yep.
That's a good one. I like the rib mode. I'm gonna come on right side down. Is that cool?
Yeah, that's cool.
Yeah, Angie's got good technique.
She does.
So Angie's one of the new chiropractors in here. She's been working with us the last, not even that long. Has it even been a couple? It's been a couple months, full time, maybe a month. But she's already like got her own little patient group coming to see her. It's pretty cool to see how quickly she's gotten busy. Nice. You're quick. Seriously, your line of drive is like, it's right there. It's good motion. You set me up nicely. Good job. So relative to like reps and manipulation and time, like Kendra's gonna get a ton of it in the next 8 months. A ton of it on me too, hopefully.
Oh yeah.
Oh man, goodness. I'm gonna stop talking. Good. That was better. Line of drive was good. It went through, the force went through the area that you were trying to manipulate, and honestly, it's a good position. You'll roll me more, and you'll pull more with your arms. It'll be more of a full body activity.
Yeah.
And you'll be relaxed while you do it as you're doing it. But that's a good start.
Yeah.
Good job. And can you do traction on my hips?
Yeah.
Thanks. Oh yeah, here at Keystone Chiropractic, a la carte adjustments. Nice, good job. So, and just strong. I'll never forget. Like I was not as forceful and firm with my adjustments as Kendra is right now.
Really?
Coming out of school. Yeah, I think you're just naturally strong. You have good hands. Thank you, Kendra.
You're welcome. I'm sweating.
Wow. Appreciate you. I'm so grateful that she's here. She's going to do some dry needling on my low back, some shockwave on my heel, and we're going to do that tomorrow because I have to run home to my kids that are running around the house right now. And my wife's like, "Where are you?" So I gotta go. But thank you very
Of
much.
course,
Appreciate
anytime.
it. We'll be doing some videos with Kendra. We'll be talking about maybe some of my problems because I think that they're relatable. I know they are. They're very relatable to our patient population. And then showing you some ways to really help yourself on our YouTube channel, as well as to just doing some group learning. Like Kendra will be real. Like she's finishing up school right now. She's still learning. Heck, I'm still learning. So we're gonna apply some new things. We're gonna learn together, and hopefully we'll teach you some things along the way. So thanks for watching. And if you're in Baltimore, come on down. Let us help you. Cool. Hey everybody, this is Dr. Warren here at Kelstein Chiropractic. I'm with Sydney today.
Hello.
Sydney is a junior
Yes.
at Towson University, and she is kind of figuring out what direction, nursing, public health, kinesiology, she's kind of dabbling. I think you're leaning towards nursing.
Yes.
Yeah, which I'm so excited for. They got a great program here in Towson, at Towson University. So I don't know what's going on with Sydney, so we're going to find out right now. She reached out to me in the middle of the shift. She's like, hey, I know you're helping out with that guy's back right now, but I also got this thing. So what's going on?
I don't know what I did, but by my shoulder blades, both sides, bilateral, there's just a lot of pain, even just to the touch.
Okay.
The left side is a little bit worse, but Nicole definitely pointed out that my back felt hard.
Okay, so one of the staff members came up and was like, whoa, these muscles are pretty tight.
Yes.
All right, tell me in the last couple of weeks, anything changed for you in terms of routine?
I just moved my apartment. Maybe a little bit of heavy lifting. I just moved upstairs though.
Okay, so going upstairs, new spot, new start.
Yep.
There we go. And so you maybe the lifting. You're back at work right now. You worked a little bit more too in the last week than you're used to. So we can attribute towards maybe a little bit more hands-on work here. It's a physical job. Up and ready to go at 7:15 in the morning.
Yes.
Bright and early, punctual on time, ready to roll.
Yeah.
Yo, there it is. And so.
Oh, and I did radio shockwave yesterday. Eddie did radio shockwave on me.
You got radial shockwave on your mid-back?
Yes.
Really?
Upper.
And upper? So the traps?
Yep.
Okay. Definitely. And then, so with radial shockwave, sometimes we tend to stay, we go towards the midline only on the mid-back. Got to be very mindful of it.
Eddie
To the
was
point
very
where,
mindful.
yeah, we'll look at doing some soft tissue work instead as well, and maybe some dry needling if we need to, if the muscles are a little tighter. And then we'll lean into that for other things. So relative to all of that, let's take a look at your movement, okay? Take your stuff out of your pockets for me if you don't mind. And you can, honestly, I'm going to be doing the talking here and you're just going to be moving. You can take your mic out of there too if you don't mind. That way you're not laying on that. Okay. And then come over here towards me. So you've been adjusted before by one of the other docs too, and I think I adjusted you early on, right?
Yep.
There was nothing that has been bothering you since then except for this. This is the only kind of complaint that you have. Your neck feels okay, low back's okay?
Yes.
Beautiful.
More so just upper back. Sometimes the shoulders, but that's been good because I haven't needed to walk here with my backpack.
Yeah.
So just upper back, traps, maybe a little down to the mid back.
Okay. All right, let's take a look at you. Let's see how well you move. All right, let me just watch you turn your head to your right and to your left, just nice and easy. And can I guide you?
Mm-hmm.
Nice. Okay. So turn to the right again. I'm just going to push you a little bit there. Good. And then to your left. Good. And then face me. Good. Bring your head back for me. Good. And rotate. Easy rotate. Just a little pressure in there on that left side. Bring your chin down to your chest. You carry it here a little bit relative to a little bit more stress or tension, yeah? So we'll take a look at that too. Okay, let me see your arms come up. Look forward. Just globally looking at her shoulder range of motion and what's going on here on that left side, why she's a little limited. Don't know. We'll figure that out. You can face this way. But not the first time I've seen it. Go. A lot of people have kind of this pressure here that affects how their shoulder moves here. Nothing a little bit of good PT, a little bit of work can do to keep some balance in there. Okay, go ahead and do this for me, Sid. Go ahead down and touch your toes.
Already cracking.
Get a little bit there. Yeah, your low back moved. That was a little freebie, as some people say. I'm going to push you a little bit here. Let your head fall. Good, and then come back up for me. Good, do that again. This time, nice and easy. Hands up. Good, and go down towards your toes. Good. And then come back up for me. Good, and relax. And relax, good. And then you're going to take your head to the side here. I'm just kind of feeling and seeing patterns of movement for her functionally, where she holds a little bit more tension. She self-reported that she has pain here, stiffness in this general area. Someone also said that your muscles are really tight in that area, so we're going to work on those things. In order to do that, we need a gown. And here we go. All right, so now that we have the gown on, we can do a little soft tissue work. We can take a look at her shoulders. When I do soft tissue work for her, you can come on this side. We're going to talk about the obstacle being the way. Isn't that right, Sydney?
Yeah.
Tell me about that for you. How do you use that in your life?
Alright, that hurts.
Hey, that hurts?
Yeah.
That rubber hurts?
Yeah. I told you it
It's
hurt
sore.
to the touch.
I know, I believe you. I believe you. I'm sorry. I should have minded my touch. Yeah. All right. You let me know if it feels comfortable or if it gets to that point where it hurts. Okay? Again, just like you did. Would you mind if I unstrap this?
No, it's fine.
Okay. Is that okay? So what do we do for muscle ache, soft tissue work? We do some using acupuncture needles, do some dry needling on the paraspinals. She is very sensitive right there. Now you're anticipating me a little bit. It's okay.
No,
Here.
the left side is weird.
Is it worse?
Yes. I don't know why. Okay.
Right there? So kind of both at that, honestly, right around the brow line. And these ribs are really sensitive right here. It's going to feel good to get adjusted once you relax a little bit more. No, not that you're like tensing up, but once the involuntary, where you're not thinking about it, that muscle tension, once that goes away, it'll feel really good to get adjusted, okay? And the way that I'm going to do that with you is using, like, my favorite thing to do in conjunction with tight muscles is dry needling and laser therapy, but we can't go over that tattoo. We're going to be mindful of that. Okay, bring your head back for me. Good, head down. We're going to do some just easy stretches through the shoulders. So come back to me and tell me, how do you take this saying right here into practice?
I try not to get discouraged with certain things, especially being a college student.
Head back for me.
So it's kind of just a
Head
reminder
down,
to
nice and
myself,
slow.
although I can't see it. And then the flower is my birth flower. It's a carnation for January.
Nice. And that's just to signify your birth?
Yes,
You like that flower?
I do like that flower.
There we go.
My grandma also loves that flower.
Tell me about what's been the most challenging being a college student.
I'd say finding a balance, especially just transferring here and never having been to Maryland before.
Mm-hmm.
It's kind of difficult to meet people and figure out what I wanted to do, but I've just been trying to be in tune with myself and trust my own instincts. So
It's good. Scooch over to your left for me just a little bit. I'll keep your gown nice and secure. Give me a little more space than that. Just a little more space than that. There you go. That's good. I'm going to sit like this, okay? You're going to take your arm and you're going to reach it just in front of you, nice and slow. So that balance is something that you've had to create on your own for the first time, more than not, if you will, between work now for you, right? School. Go ahead again, reach. Social. A trajectory in your career, thinking about that, and the opportunities that you get to work in that space. And that's awesome. I think that's really healthy that you're accepting that challenge the way you are. I think that's part of the process of going through college and figuring it out. Mm-hmm. Yeah, and already we are very fortunate here. People like Sydney that come over here and apply and work with us. We have another 6 people like that in the office that support the chiropractors in here, and they all just are very driven, And it comes off in the experience the patients have in terms of the quality of and professionalism that they provide for people. And we got some bumps along the way getting there, right?
It's okay.
We're learning. You're open. I'm trying to be open in terms of my process of growth. But you're doing a great job. I'm really grateful for you in terms of you applying yourself and putting yourself in positions to get outside that comfort zone, Sydney.
Thank you.
Yeah, well
A
done.
little louder this week.
A little bit louder? I love to hear it. What about that solid 7? You giving some of those out?
Sometimes.
Yeah? Not as much. When the situation suits you. Is that right?
Yeah.
There you go. Hey, that's what I care about. You stop trying, then we have a different conversation, right, Sydney?
Yeah.
But you have, every time I've given you good feedback and stepped in and been like, hey, this is kind of something I see, this could be more beneficial, you're very open to it, and man, I can work with that forever, all day, and then the rest of these guys are like that too. Carly, on the other hand, I don't know what I'm going to do with her. I don't know. Tell her, you know, she says, I'm hot in here, and I say, take off your jacket. She goes, nah. I was like, well, what am I supposed to do with that, Carly? No, I'm kidding, Carly. You're wonderful. Go reach. Carly's behind the camera. You broke it.
I got
We broke it.
I'm allowed to.
Oh, you were allowed to. We broke the 4th wall. There you go. You doing okay with this?
Yeah.
There you go. Now you can kind of like, initially, it's a little bit of like, oh, shoot, that's tender.
Yeah.
And then you're like, okay, I can get into this. Okay, wait, now he's actually working it. And now, that's what I mean. Like, that's what's going to happen too with some of the needling and the laser therapy. All right, you're going to scoot to where I was. I'm going to get down the other side. I'm going to do the same thing to your other rhomboid, parascapular muscles. What's that?
I'm scared for this.
Why? Oh, because it's more sensitive?
Yes.
Remember what I said in the beginning?
No.
I said a lot of things, I guess.
Yeah, you did.
What I said was about feedback to me on touch.
Okay, yes.
If it's too much,
I'll let you know.
just let me know. Just no throwing punches. No, just respectfully cross that bridge for me. Here you go. Reach in front of me. Good. Just nice, easy pin and stretch. ART, it's just such a helpful modality in here. ART is the name of the technique that I'm using for muscle work on her.
Yeah, dude, hitting it.
Not yet.
No.
Oh, right, coming down. I gotcha. We'll get there. We'll get there. Here you go. Reach. Just nice and easy. Good. Come back. Good. Again. So. Good. Try. Good. So it's my first weekend where multiple days in a row my daughter gave me a full spine adjustment. Scarlett, my 3-year-old. She's like, Daddy, lay down. She's like this is what it look like? She like takes my arm, she's like yanking it over here. So sweet. Here you go. Go ahead. Blood pressure okay? Awesome. All right, this is the tighter muscle. You ready for it? Crisscross your arms like you're a mummy. You got it. And rotate to your right. Good. And come back. Pressure okay? Good.
No pain, no gain.
A little bit of that. A little bit. I mean, honestly, it should, at the very least, get better and better. In the beginning, it's a little sensitive, right? And then the last one here, okay? You're going to come back and extend. You're going to go down. I'm going to catch you with my arm here.
It's still cracking.
Yeah, you might be cracking a little bit. There you go. I'm going to pull you. Let your body weight go forward. There you go. I'm going to pull you and push. This is going to be the most intense, okay? Head down. Breathe in. Easy. Exhale. Remember what I said. You can let me know if it's too much pressure. Good job. Good. Easy. Loose, loose, loose. Reach, bend, bend. Good. We can do a similar pass on this right side, okay? All right, so now that you're getting ready to enter into potentially nursing school, yeah? What's the goal after nursing school?
Become an RN.
RN?
And then get my master's eventually and become a PA. PA has always been my end goal. Physician assistant.
In what setting?
I want to be in a hospital or in aesthetics, like the Botox.
Nice.
Ow.
Okay, is that your way of saying that's too much pressure? Just ow. That's fine. That's good. It's good communication. All right. So easy, soft tissue work until the end there. That was intense. Go ahead and stand up for me. I'm gonna bring the table up. I'm gonna adjust your mid back. I'll look at your shoulders, your neck. A little tight through here too. We can work on that. Okay. And then, have you had dry needling before in here?
Once for a migraine.
For migraine? Okay. Yeah, definitely. Okay. Relax on him. So you've had it. That's probably more of a. It's actually not that as bad as it seems, if you will, from a sensitivity standpoint. This is really not bad in terms of what it feels like, okay?
Doesn't feel good.
What's that?
Doesn't feel good.
The needling?
No, the back.
Oh, you mean the symptoms you have in your back? Yeah, let's get you feeling better. That's what we're doing. So let your body rest. Good. Settle your hips, settle your low back. You'll feel a little pressure here, okay? Take a deep breath in. On the exhale, let it go. Good. A little release there. Good. And then don't anticipate me. There you go. Definitely don't hold your breath. Good. Take a deep breath in. Easy exhale, let it go. Good. Gentle. Gentle. I want you to lift your head for me here. Good. Good job. Nice. Yeah, I know that's intense. That's like one of those adjustments like, oh wait, I needed that right there, in terms of getting quality movement in a tighter area, those restricted or fixated joints. So good. You did well with that. Okay. Good. All right, little release here. Okay, Sid? So here's your pressure. Good. I got you. There you go. It's actually pretty good. Okay, table's gonna come up.
I did crack my neck before.
Yeah, come on your back for me. It's gonna move a little bit though.
I can only crack it one way.
Really?
I can only go this way. Now I can't go this way. It feels like I'm gonna snap my neck.
Yeah, definitely don't do that. Here you go, I'll take that for you. You got it. Good. And then relax here. Okay, do me a favor, turn your head to your right for me. I'm gonna check your upper back a little bit more with this. Hold on to my back. Take a breath in. Easy and relax. Let your shoulders relax down. Little pressures up top. There you go. It's gonna feel good. There you go.
It's great ASMR.
What's that?
This is great ASMR.
Oh yeah. No, I'm happy for you and happy for the people that like that too. Turn your head to your left for me. There you go. And then reach. Take a breath. And relax. There you go. That feels good. Just the release. Good. All right. Good. It's really all on your right side. So you're gonna feel a little movement on the left, not much, okay?
Okay.
Good. And then let your head fall this way for me. Good. There you go. Okay. Totally psyched you out on that prep. It was good movement. Here you go. Lift your head up for me. The right side's a little tighter though, okay?
Okay.
Good. Okay. Gentle, gentle. Good. Now let yourself settle. Good. There you go. Good. Okay. Good. Your upper back moved well. That one spot that was really locked up on you moved nicely. You might be a little sore there because it was stiff and a little irritated. And so to stop some of that soreness from happening, we're going to put a little heat on your mid-back in the form of some light therapy. It'll feel really nice. I'm going to hold off on dry needling just because it was so sensitive. And we'll work into that later on if you still need it. Okay? Does that sound good?
Sounds great.
Thanks for coming in and doing the video. I was going to say be on my page, but that doesn't make sense. Thanks, Sydney, for doing this. Appreciate you. Thanks for watching. She's going to get some light therapy. You can check that out. And Carly's going to ask her some really good questions while she gets it. Good job, Carly. Keep up the goat. Oh, look at that.
Yep.
No hesitation.
Never.
Locked in. Never. That's change right there. That's growth. I appreciate you.
I appreciate you.
Thank you. Thank you for watching. I hope everyone out there is doing well.
Hey everybody, it's Dr. Nick here at Chiropractic. We're here today with Dr. Brady, and some big news on the home front here. Dr. Brady has recently been given the award of fatherhood. His wife Katie gave birth, 2 weeks ago?
3 weeks today.
3 weeks.
Yeah,
3 weeks
it's flying by
day.
already.
Big day for him. Big step in life for him.
Yep.
Both baby and mom are healthy, which is awesome. But with the new baby comes lack of sleep.
Absolutely.
And Brady is struggling a little bit, and his body's feeling a little creaky. So we're gonna give him some TLC. We're gonna get him adjusted full spine, and treat him up.
Sounds good. Nobody ever talks about the fathers having to sleep like on the recliners or anything. You know, it's pretty rough for us too.
You're gonna have some enemies. The recliners. Oh shoot. I can tell you've been sleeping on the recliner. You got booned.
Oh goodness.
Ya. Oh man. It's been a while since I've worked with you, or you've been worked on in general.
Yeah, it's been months.
Yeah.
Yeah.
And it shows.
Yeah.
All right. It's pretty restricted through his mid back. Pretty stiff through here, Brady. All right. Take a breath in.
Yeesh.
Do another breath. And let it. Beautiful.
Yeesh.
Moving well. So I think so if it's 3 weeks ago, 3.5 weeks ago, we were all sitting in the office, and I think we're giving Brady some crap, or at least I was, because it was a Monday, and it happened on the following Tuesday. But I was telling Brady, we were asking what weekend plans and everything were, and I think he said he had something going on. Oh, is your tattoo appointment, right?
Oh yeah,
You
yeah.
finished up your tattoo appointment.
Yeah.
And we're saying he's going to be a dad before the weekend, and
Yeah.
made the comment that you're like, I am not ready for that.
That is true. Manifestation. Yep.
Thrown into the fire and thriving.
That's right.
Oh, left side down.
Let's sit down. You got it. Have you been climbing a lot lately?
More so. Not as much as I would like to be,
Yeah.
but definitely getting in there a lot more. Let that hip roll.
Oh yeah.
Other side. Had a little Jeff tap in
let's
there
spin
for
a
a
little
second. Went on autopilot
Yeah.
and it came out.
Got me distracted.
No, you're
Oh, this guy's just too good.
You grew 2 inches.
Hey, Bryson grew 2 inches too.
No kidding.
Yeah, in 2.5 weeks.
Being in that man some
Yeah,
muscle
he's
milk.
he's got some hands, some big feet. Oh yeesh. Oh man.
So-
it's been a while.
Are you gonna let him choose his own sports that he wants?
Yeah,
to play?
absolutely, absolutely.
Selfishly, what do you want him to pick?
You know, football would be nice.
Wow. Brady never played football. Did you play football?
Yeah, I did. Until 11th grade, actually. So almost all my, yeah. But yeah, whatever he wants. Basketball would be nice. Lacrosse is huge down here.
Yeah, a little pressure here.
Oh yeah. Gotta start thinking about Halloween costumes too. I haven't thought about that really this year.
I saw a video where it was the parents had decorated, probably the mom, if I'm being honest, it was a little too creative, but they had, I kind of like the one, the wagons that people use groceries to pull around, you know, like that have like the
like
fabric sides and stuff.
Oh yes, yeah, yeah.
But they turned it into like a little cage with like posts going up, and it had like the stretchy cord around it.
Yeah.
And the baby was dressed up like a dinosaur.
Oh, I like that.
And the parents were.
I like that.
Oh.
Jurassic Park, like
Jurassic
type?
Park.
Yeah.
Yeah.
Okay.
Yeah. It was a Jurassic Park theme, but I thought that was pretty cute.
That is cool.
Cool.
Nice.
So
I feel a
to
lot
close
better.
out the video, that's what we're gonna do with Brady. We're just gonna adjust. He doesn't need much more than that. He's feeling pretty good. But big congratulations to him. If you guys gonna send him a coffee, you know, that'd be great. He's absolutely ran through all the coffee in the office.
Yeah, I was gonna say I've been staying caffeinated. That's for sure.
Cool. We'll catch you in the next one, guys.
Thanks, Dr. Nick.
Oh, you're so welcome.
Buddy.
I mean, shoot, if you got 5 minutes every 1 hour, we got 9 hours of work. 9 times 5, 45.
Yep.
45-minute nap a day. Plus lunch. Whew. Count me in.
Your REM sleep would be all screwed up.
Might be worth it though.
Yeah.
My money, don't jiggle.
Yeah, whenever you're ready, man.
Oh, okay.
I don't know.
You just stare at Carly until she starts getting awkward.
I was born that way.
I'm born that way. I forgot an intro. It's been so long.
Oh, like.
Okay, I got it.
Hey everybody, Dr. Warren Kelstein here with our new chiropractor on the team, Dr. Angie Darkus, and you are joining us. This is your second full week here.
Yeah.
So excited to have you. We're gonna do a little introduction to her as well as to something that I'm doing over the next 4 weeks. I have a triathlon coming up. I've never done a triathlon. I think Carly just kind of, or maybe you said that, you're doing like couch to 5K. I'm doing couch to triathlon a little bit. I'm active. But these next 4 weeks will be pretty important for me as I ramp up training.
Absolutely.
And Angie, Dr. Angie will be really helpful for me as well. Thank you, Angie.
You're
I just
welcome.
signed you up for that. I appreciate you.
Let's get it rolling.
Yeah, we're going to be doing some work in here with shockwave, with dry needling, with light therapy and adjustments, and I'm going to get in some body work along the course as well as massage. I'm just fortunate. I say all this, I'm like, damn, I'm lucky. I got access to a lot of really good healthcare, but I want to share the experience with you. So one, I can do our best to educate you on recovery and conservative pain management, as well as wellness and function on that journey. And then in the process, I just show you kind of my training schedule that I'm working on right now. So,
Awesome.
Cool. Hey, so how'd you find us?
Well, actually, someone found me on LinkedIn.
I did, and I'm so grateful that I reached
You're
out.
like, hey, we just happen to be looking for someone, part-time or full-time. Hope you're interested.
And that worked. Instead of sitting around waiting.
I mean, yeah.
Thank goodness. And it just worked out kind of in a great way. So tell me a little about your journey. How'd you get to chiropractic school?
So I always knew I wanted to work with people, loved working with athletes. Starting in high school, I worked with an athletic trainer. Already getting stuff moving. We like it.
We like it.
So then from there, he was like, don't major in it. We don't get paid enough for what we do. And I said, absolutely. All right. Thought I was going to pivot towards PT. And in my undergrad degree, I had to do 1,000 hours of internship, and I studied under a chiropractor for a portion of that. And he taught me all about chiropractic, what it means, what they do, how they help people. And I was like, wow, that actually really aligns with how I want to help people and how I want to be preventative and proactive, help athletes and help people just function in life better.
Mm-hmm.
And yeah, started applying to chiropractic schools, and here I am.
So in the beginning of this video, I had some things I wanted to say, and then I forgot to say them. And then that quickly, Angie just reminded me of what I wanted to say just because in this moment. I mean, what a wonderful person that's joining our team. Just such good values, such a strong work ethic, and good with her hands. Really good with her hands, good touch. The first time she came in and in the process of interviewing, I just had her work on me, and I was like, oh, she just totally. You could just feel how people are comfortable and modify touch, pressure, and movement, and get a sense of things relative to the adjustment. And she's got that. She knocks that out of the park. But on the back end of that, you can't always pick the person, right? And we just got so lucky with the person. So shout out to Angie.
Thanks.
Yeah. Thanks for reminding me.
No problem. Glad I could be the person.
So wait, you shadowed this mentor, this chiropractor, and you're like, wait a minute, this is kind of. I didn't know this is what I wanted to do, but this is kind of lining up with what I wanted to do. You played volleyball, right?
Yes, I played volleyball in college. I played at Norfolk State, so Division I, and he was our chiropractor at our school as well as one of our department professors.
Right on.
Go ahead and take a breath in and breathe it all out. Good. Awesome. One more time, breath in and breathe it all out.
So he was an educator and a mentor,
Absolutely.
And he was working on you relative to the athletes.
Say that again?
He was helping the athletes. He was working with the
Yeah,
athletes.
so what started it was we had to run a mile in under 8 minutes or something, and I would run and I would start feeling this hip pain, and I was like, maybe it's my shoes, and I changed shoes and it still kept happening, and I went and talked to him, and he was like, well, let me check your hips. And he looks at my leg length and he was like, well, it looks like your right leg is shorter than the left, but it's because of your back. Do you have a lot of back tightness? I'm like, yeah. Everything's one-sided, the way I've been hitting and everything with volleyball.
Mm-hmm.
So he worked on me, and immediately it was next day I went running and cruised. I did my 7:30 mile, and I was like, perfect. This is great.
You were feeling
and,
good.
Oh yeah, I felt like I was quicker. I felt like I had more just body connection. Go ahead and lay on your side facing me.
Sure thing.
And yeah, I was like, wow, this really worked. And when I was interning with him during my hours, I had shoulder surgery after my senior year, and I was having pain. I tried PT, worked with the athletic trainer for many months, and ended up having surgery, and it helped a lot. But I went to him when I was doing my rehab, and that was where I had a lot of relief, got full range of motion. Breath in, breathe it all out. Good. Good, one more. And to the other side for me.
So you rehabbed, you said your shoulder?
Mm-hmm.
No. Was it a rotator or a labrum for your shoulder?
So I just had really loose capsule. I'm hypermobile a little bit, but they were like, we're surprised we haven't dislocated your shoulder. I'm like, yeah, I'm glad I haven't. But so they just tightened the capsule, and it was supposed to be a thermal shrinking, was what they told me, kind of shrink wrap it. But when they went in, they were like, it's really loose, so they had to pleat it and stitch it.
Got it.
So yeah, went through that, did the whole rehab process, and would do some of the modalities some of the ones we have here, but not all the fancy ones. Breath in and breathe it all out. Good. Nice. And flat on your back.
Oh, that's lovely. Thank you.
You're welcome.
All right, so you've got this great experience from an education standpoint as well as a therapy standpoint, so you're leaning that way. Where'd you go to chiropractic school?
I went to Palmer College of Chiropractic in Florida.
Florida.
Yeah.
Was Florida calling your name, or was Palmer?
More so Palmer was calling my name than it was Florida. I liked the fact of the school size itself. I felt like I had a bit more of an intimate, teacher to student ratio.
Sure.
And just the mindset that they had, and just their philosophy, and how it was very integrated in chiropractic and rehab and physical therapy side. It was kind of all encompassing, it felt like. So
nice.
I liked that.
Was it what city in Florida is Palmer?
Port Orange.
Port Orange.
So
okay.
just south of Daytona Beach. So we were about central PA. or Central PA. Sorry, Central Florida.
No, you're good. You're thinking about Central
I am.
PA right now.
There's a lot going on up there.
Yeah, there is.
It's like lots of wedding planning up there now.
Come on.
Yeah.
Angie recently you got engaged recently?
Yes, back in December. And we're planning our wedding for spring of next year. And we just, honestly, today officially decided on our date and our venue. So it was exciting.
Nice. Congratulations again.
Thank you.
Mhm.
All right, little adjustment here. We're gonna wrap this up. Good. Wonderful. Higher on the side. Awesome. Good. All right.
Yeah, I think we need to do like once a week introduction videos for Angie. That should be a good plan.
It's like I got a lot of stories. I can talk a lot. Oh, good. You said it was your right hip that gives you issues?
Yeah, you got it.
Good.
Yeah, we can talk about my hip next time a little bit.
Okay.
Talk about how we treat labral tears and tendinopathies, which I got going on in there.
Was that from lacrosse?
Life,
Life. Okay.
but probably a lot of lacrosse too. Yeah, definitely.
All right. We coming up?
We're coming up.
Okay.
I feel great. Thank you so much.
You're welcome.
Awesome. So we'll jump back in. All right. We got a lot more questions to ask.
Yeah.
All right. How about this? What questions do you have for Dr. Angie? Put them in the comments below. We'll do follow-up videos if we get those questions. Carly, like and subscribe, please. If you're watching and you're not a subscriber, please subscribe. It helps our channel a lot. It helps it grow. It helps us reach more people with good quality care, good quality people in here, evidence-based care, and showing different ways of approaching different problems. And hopefully that this channel grows in the process and we can serve more people. So thanks for watching.
Absolutely.
Thanks for joining us, Angie.
Yeah.
Peace.